Imagine working a full career and feeling healthy every day. You cut concrete, weld steel, and breathe the daily dust. You feel strong and go home with clear lungs. But decades later, a silent debt comes due unexpectedly. Crossing a simple living room suddenly leaves you gasping for air and struggling for breath. This is the hard reality of workplace lung disease. One tradesman breathed dust and fumes across his entire career. He was proud that he never wore a safety mask. The work felt fine, and his breathing seemed completely normal. But retirement brought a heavy physical cost that he could never have anticipated during his youth. He paid for his pride with short breaths at home. You get only one pair of lungs in your life. They must last long after you stop working on site. Cutting, grinding, and demolition produce very fine dust. Welding and other hot work tasks release toxic fumes and gases into your daily breathing zone. These substances cause permanent damage deep inside your lungs. Yet, these serious hazards are very easy to ignore today. Think about the obvious risks on a busy construction site. A fall from height hurts you right away. A deep cut bleeds immediately and sends you straight to the first aid station for treatment.
That should do it.
But
Just make sure
breathing
to keep it
fine
clean.
dust does nothing you can feel today. You finish your shift and go home feeling completely fine. There is no cough to teach you a painful lesson. This lack of warning is why workers skip their protection. The unseen damage accumulates silently deep in your delicate lungs over many years of exposure on site. Each small exposure seems too minor to cause real harm. A single breath of dust today does not make you sick. But these small daily breathing events add up over decades. Your lungs slowly collect fine particles from every single shift. This silent microdamage continues to grow every single day until your healthy lung capacity is completely gone. The heavy bill does not arrive for decades. It appears as breathlessness, severe scarring, or fatal cancer. By then, the permanent damage cannot be undone. The list of dangerous materials on site is very long. Silica dust from concrete, stone, and brick cutting scars your lungs over several active years. Asbestos fibers from older buildings cause deadly lung cancers. Fine wood dust also damages your breathing over time. Welding fume is now recognized as a lung cancer cause. Flour and paint isocyanates cause severe occupational asthma. These common workplace substances can end a promising trade career in a very short time. You do not need to memorize every single hazard. You must simply realize that everyday dusts are dangerous. They harm you even when you feel perfectly fine. Because the damage is silent, protection cannot wait. Once you actually start showing these physical symptoms on site, the permanent damage is already fully done to your body. You must protect your lungs based on clear understanding. The correct order of controls remains the same always. First is stopping dust from getting into the air. Use water suppression when cutting concrete on site. On-tool extraction systems are excellent because they suck up harmful dust directly from the cutting tool. Dust control at the source does not just protect you. It also protects fellow workers who are nearby on site. Unprotected colleagues breathe in drifting fumes without knowing it. Airborne hazards can easily travel across the shared workspace. This is why engineering controls at the source are far superior to relying only on personal safety masks. Local exhaust ventilation pulls toxic welding fumes away. Good general ventilation keeps fresh air moving constantly. These controls protect everyone, not just the task operator. Source control is always the most effective defense. Personal respiratory protection serves as the last line of defense to handle whatever the main source control cannot fully capture. We must ask ourselves some honest questions about our daily work today. Do we skip our breathing protection because our lungs feel fine on site? Are we actively controlling dust at the source or just relying on masks? What invisible hazards are we breathing in during this shift right now? Discussing these crucial safety questions as a team helps everyone stay safe and watch out for each other. A mask only works if it matches the hazard. The respirator must be fit tested to your face. You must be clean-shaven to ensure a seal. A mask leaking around stubble is protecting nobody. We must also participate in site health surveillance and take lung function tests when offered. These checks catch early changes before symptoms show. They monitor the one organ we cannot feel failing.
Take a deep breath in.
A great
Now blow
career
steadily
ends
into
with
the
healthy
tube.
lungs in retirement. Every small daily exposure decides your future health. Control dust at the source first. Wear proper respiratory equipment and protect the lungs you need for life. Thank you for watching. For more practical HSE-related videos, please subscribe to our channel. Watch the next video appearing on your screen now and click the link below to learn more.